In this video, we will talk about 5 different types of diets or dietary patterns for people with diabetes so you can possibly get off some of your medications as well. Hi, I'm Dr. Khan. I'm a board-certified internal medicine physician, and here we talk about matters of living a healthier and longer life by doing the right things. So these are some of the 5 diets that we're going to be talking about today: the intermittent fasting, the Mediterranean diet, I lost space over here, low-carb ketogenic diets, the Paleolithic diets, as well as the vegan or the vegetarian diets. So these are 5 diets that we'll mention today, and I would also like to go over some of the pros and cons. Now, keep in mind that the best diets for diabetes are diets that you can carry over and stick to in the long run. And keep in mind, any of these diets that you plan to initiate, you have to talk to your doctor, because sometimes you may need titration of your medication because you don't want your sugar levels to drop. These diets can be fairly quick in acting to get your sugar levels down. But, all right, so frankly speaking, why do we need to control our diabetes? Because frankly speaking, if we do not control it, it may kill us sooner rather than later. Let's begin with this. Eye damage. You can have hemorrhages, bleeding in your eyes. That is not preferred. You can lose your vision. Then kidney damage is a big problem. People with diabetes routinely end up going on dialysis. That is, your kidneys don't work and you have to clear up the toxins from your blood by going on a machine 3 times a week. That is fairly inconvenient, I would say. Then diabetic foot. What happens in diabetes? Your blood supply diminishes in your foot and you get infections, and slowly and steadily they cut off pieces of your foot, your toes, and then your foot, the whole part of your foot, your heel, and then your leg as well. People have amputations when they are diabetic and your diabetes is not controlled for a while. Now, what else could happen? You could have peripheral neuropathy, basically meaning that you cannot feel what is happening in your toes. And what could actually happen, that rats may be eating up your toes, but you will not be feeling those rats eating up your toes. This is what peripheral neuropathy could do. A milder form of the neuropathy is basically you have decreased sensation and tingling and numbness sensations. So that is bad in itself. Then, of course, diabetes can give you heart disease. It can give you cardiac problems. It can give you strokes as well. It can give you cerebrovascular disease. So diabetes, my friends, is something that we should try to avoid. And if we have diabetes, we should try to control it and get rid of it if possible. Now, the best diet that I prefer, I prefer different types of diets, but one thing that I definitely prefer, it has other benefits as well. It is called intermittent fasting. And this is the top mentioned right over here. Intermittent fasting is something that I'd do promote. Now, intermittent fasting is also called as time-restricted feeding. And this is one of the types of diets where you are not eating for a certain period of time. Some people prefer to fast for 12 to 16 hours, and 16 hours, the more you do that, the better it is going to be. Now, you can have a look at this article. You can look at this later as well. Clinical management of intermittent fasting in patients with diabetes mellitus. And this is a good paper. You can research this later on as well. However, this article basically goes to show and does prove that insulin resistance, which is a cause of diabetes, basically meaning that you have insulin in your body, but the insulin is unable to balance out, unable to lower out your sugar levels, right? So insulin resistance has been known to decrease when you fast intermittently. And any period of fasting, your insulin sensitivity rises and your insulin levels fall. Insulin sensitivity rises. That basically means that you need less insulin to bring about a decrease in your sugar levels. So fasting helps out in improving your activity of your insulin. And when you have less insulin in your blood, then you won't develop fats, because insulin actually promotes fat deposition and weight gain. So gotta definitely check this out. Now, the next diet we're going to be talking about is, of course, going to be the Mediterranean diet. And this is actually one of the diets that I prefer as well. And if you have a look over here. Mediterranean diet does look pretty appetizing and appealing. Doesn't have too many meats, but you can have meats in a Mediterranean diet. And this is the type of food that people used to eat in Italy or Greece back in the day. Nowadays, everybody is Americanized with fast food, so don't follow the Mediterranean diet these days. So what is part of the Mediterranean diet? It consists of plenty of vegetables, fruits, nuts and seeds, whole grains, lots and lots of olive oil, lots and lots of olive oil. This is what people like with the Mediterranean diet. They can drink tablespoons of olive oil, fish and eggs. This is all part of a healthy Mediterranean diet where people basically look to consume lower amounts of carbohydrates, not refined carbohydrates, and they look to consume healthy fats and healthy proteins. This is what they tend to consume in the Mediterranean diet. Now, if you actually have a look at this study where they have a good, this is actually a good review paper on the Mediterranean diet and diabetes, prevention and treatment. And in this, they talk about that most studies on the Mediterranean diet show a beneficial effect of on type 2 diabetes. Your glycemic control, your sugar control is much better, and your insulin sensitivity is much improved, meaning that you need much less insulin to control your sugar levels. And the amount of olive oil that people consume in this type of diet and fish oil that people consume in this type of diet is also fairly heart healthy as well. So Mediterranean diet should be on the top of your list, along with the intermittent fasting that I talked about a little earlier. Now, moving on. So next is going to be low carb, ketogenic diets, or there are other models and other versions of low carb diets, but a ketogenic diet pattern is actually fairly common, and there's a lot of people trying to go after this diet, and it is actually a good weight loss plan as well. And in this type of diet, the important thing is what you don't eat. You don't eat potatoes, you don't eat rice, you don't eat bread, cakes, sweets, bagels. Most of these things I think you should not eat in any case as well if you are a diabetic or do not want to develop diabetes. I think this is what you should avoid normally as well. But people in the low carb diet, they do eat lots of fat. And I want people to eat healthier fats, more fish fats instead of garbage and burgers and trans fat. That is what I don't want people to be doing. People in this type of diet also, they do eat lots of vegetables, and I do want people to eat low calorie vegetables with the ketogenic diet. And people also tend to eat lots of fish, meats, fatty meats, as well as eggs, whole eggs. They don't eat just the egg white, they eat whole eggs. Now, if we definitely move forwards, there are lots of studies. On not too many studies, but there are a couple of studies that show the benefit of in diabetes type 2 with low carbohydrate diets. And if you want to look at this paper, you will note that there are a couple of studies, and one study in particular noticed that 44% of low carb ketogenic diet group actually discontinued one or more of their diabetes medications compared to the regular population, and only 11% of the control group was able to come down with their diabetes medication. So as I was saying, that these type of diets can be fairly restrictive, and there could be different versions. However, the ketogenic diet in the strict form, you only consume as low as 20 grams. That is fairly little amount of carbohydrates that you can have in these type of diets. But people who are able to maintain this, they do get some benefit. But I do not feel this can be carried over in the long term. Some people are able to do it. Great for them. Some people have problems that the cholesterol levels rise with the ketogenic type diets. So that could be a cause of concern. So of course, always keep in touch with your physician. Now, the next type of diet that I'm going to be talking about, it is the paleo diet, the Paleolithic diet. And this is the type of diet that tends to replicate the diet that people ate thousands of years ago, basically before 12,000 years back. And this is the food of the hunters and the gatherers. And what they used to do is they would eat vegetables, meat, fruits, and fish, but they would cut out a lot. They would actually cut out a lot of the grains. They would actually cut out a lot of the grains. And so grains including, they would cut out wheat, they would cut out bread, they cut out rice. So this is what they would not eat. This is a form of a low carbohydrate diet. But there are benefits. There are definitely benefits to eating this way. If you look at this article, this is a randomized controlled trial, metabolic and physiologic effects from consuming a hunter-gatherer Paleolithic type diet in type 2 diabetes, and definitely showed benefit. Definitely when you're consuming less carbohydrates, less grains, if you're diabetic, you will definitely have benefit. Now, if you move forward, the next and the last diet that I'm going to be talking about today, it is going to be the vegan or the vegetarian diet. Now, this is also a fairly popular diet, and these diets eliminate meat and focus on fruits, vegetables. They focus on whole grains, low glycemic index carbohydrates, and nuts and seeds. And they basically cut out all types of animal products, including dairy and including eggs. And vegetarian or the vegan diet may help people with diabetes definitely attain what they're looking for. Weight loss, if you do it properly, as well as controlling of your diabetes. Now, it will be good to have a look at this research article, review article as well, a plant-based diet for prevention and treatment of diabetes. And here they do mention that when you do follow a strict vegan type diet, then participants in some studies were noted about 43% of the participants actually on the vegan diet decreased their diabetic medications compared to 20%, 26% on the American Diet Association diet. So maybe being a vegan is for diabetes is better than even the American Diabetes Association diet. Well, in my sense, if you have a problem, if you're not able to fix it, you got to find ways to fix these problems, right? And sometimes you need to take measures and take control of the things in your own hands when regular measures don't work. You gotta try something. You gotta try something. Anyways, I wanted to talk about this today. So in this whole situation with diabetes, maintaining a healthy weight is of paramount importance when you are dealing with diabetes. And many diets help you lose weight. But of course, you have to figure out and find out what is the best diet for you, what you can stick to in the long run, because that is fairly important. But anyways, you have to talk to your physician before you embark on any of these diets because your medications may need titrating. Anyways, going over some of the diets, intermittent fasting. You're not eating for a certain period of time. And you can check out my videos on that as well. The Mediterranean diet, very good diet, balanced diet. Low-carb ketogenic diets can work, but a lot of planning is involved with these diets, and they could have side effects as well. The paleo diet can definitely work, but very restrictive and difficult to follow, but can also work. And the vegan diet, also restrictive, but can work as well. My two favorites are the Mediterranean diet and the intermittent fasting diet. Guys, let me know in the comments below if you have tried any of these diets before, and if you plan on doing anything for yourself in line with these diets. Anyways, let me know in the comments below. And again, this is Dr. Khan, and here we talk about matters on how we can live longer and fuller lives by doing the right things. You can't expect to have good results by doing the bad things, incorrect things. Anyways, talk to you guys soon. Thank you so much.